Senator, and I'd like to thank you for the opportunity to speak today. I am a physician without any background in public speaking, so bear with me. I'm a practicing OB-GYN as well as the legislative chair for the Rhode Island section of the American Congress of Obstetricians and Gynecologists. More commonly referred to as ACOG. ACOG is comprised of nearly 58,000 OB-GYNs and is respected as the leading national source for women's health expertise and information. Like Rhode Island's citizenry, ACOG's membership is diverse. It includes physicians from all manner of religious, cultural, and socioeconomic backgrounds. Moreover, like any other diverse group, our individual members may recommend or adopt very different solutions to difficult reproductive choices. Nevertheless, despite our members' differing views with regard to individual choices, ACOG as a body stands firmly in support of the privacy within the doctor-patient relationship, the sanctity of unbiased, objective clinical judgment, the importance of informed consent, and the legal right of individuals to choose safe pregnancy termination. Reproductive justice is best achieved when there is an honest exchange of information between the patient and her medical providers. Open, unscripted discourse builds trust and mutual respect within this relationship, and this trust and respect are essential when the patient is faced with difficult and/or emotionally charged reproductive choices. When thinking of reproductive justice in Rhode Island, I think of a patient with whom I shared one of her happiest moments and one of her saddest outcomes. In her first pregnancy, she and her husband were blessed with a beautiful, healthy child, and being part of those moments is one of the greatest parts of my job. Sadly, her second pregnancy presented a far different and tragic scenario. A lethal chromosomal abnormality was detected in the fetus, and it could not survive. Fortunately, this diagnosis was made early enough in pregnancy and afforded her an opportunity to terminate the pregnancy if she desired. Having a strong relationship over many years with this patient, I was able to have this difficult discussion with her about the emotional toll of carrying a non-viable baby. In addition, there were significant maternal health risks to carrying the fetus to term because of her prior maternal surgeries. I had come to know this family very well over the years, and we were able to have an open discussion of all of our options. Knowing how difficult it would be on this family as the weeks and months would progress, carrying a pregnancy that we knew would not survive, it was my personal hope that she would choose a safe termination. Before making a decision how to proceed, they researched the diagnosis, consulted with their families and with their religious leaders. Ultimately, they chose to continue the pregnancy. I respected their wishes and supported their decision throughout this difficult pregnancy. In the end, she did deliver a son that lived for about 30 minutes. I'm not here to debate this decision. I'm here today just with the goal of ensuring that all future patients have the same opportunity to make informed decisions with their families and practitioners, absent undue and unwanted influence from activists, lobbyists, or politicians. Even when outcomes are most tragic, the patient can move forward knowing that they were able to make the best decision under the circumstances with full information and candor from their practitioner. I urge our lawmakers to stop bickering over a law that has been in existence for 40 years and move forward. Rhode Island has an opportunity to work towards real solutions by supporting legislation to improve outcomes for moms and babies by expanding Medicaid family planning. This expansion would increase the number of reproductive age women who would have access to care, and this expanded access would move Rhode Island in a positive direction towards reducing our embarrassingly high number of unintended pregnancies and improving inter-pregnancy intervals, a proven factor leading to better outcomes for mothers and for their infants. Our lawmakers have an opportunity to move beyond settled law and activist ideology to tackle the more relevant problems in our state: economic growth, unemployment, education, and as for healthcare, move forward, support real and effective solutions like expanding Medicaid family planning program and enrolling our Rhode Islanders into our exchanges. Thank you.